The number of cases is rising, and UT Health San Antonio putting out a warning and a reminder to all of us during this pandemic. Dr. William Henrich, president of UT Health San Antonio, joining us tonight to answer some important questions. First of all, thank you so much for being with us tonight. Talk a little bit about what UT Health is seeing and in terms of the rise in cases and what your models are predicting right now.
I'll be happy to. As you know, we have a number of models that have helped us and guided us with regard to planning for hospitalizations and for preparing for COVID-19 patients. We're obligated to keep a certain number of beds open in case there is a public health emergency related to the virus. Now, these models are only estimates. They're just guesses, but very educated guesses as to what's happening. They're based on the number of cases, the number of tests, and so forth. And what we're seeing is a spike in cases in San Antonio, and frankly, in all the big cities in Texas right now. Back in March, April, May, we had a little bump in our cases. I mean, it was serious, but it was largely related to nursing homes and jails, and we didn't have much community spread. But now what's happening is we're getting a lot of community spread, and the number of cases is increasing. You may remember we had 3,000 COVID positive patients at the beginning of June, and today, in the middle of June, we have 4,400. So you can see how rapidly we're increasing, and it's a cause for concern, a cause for some alarm. And I think what we should do now is, what I'm urging everybody to do is return to being really careful about mask usage, personal hygiene with your hands, and staying out of crowded environments, especially crowded environments indoors.
I've been getting a lot, people interact with us, of course, because, we deliver the news every night. And a lot of people are saying, well, there's more testing. So, of course, there's going to be more positive numbers. But that's not the only thing that you're looking at, correct?
That's correct. I mean, there are two things that have happened in almost simultaneous way that I think you both know. One is that we've seen more testing, so that's a factor. But the second factor beyond the testing is we've opened everything up. Gradually, 25% occupancy, 50% occupancy, 75, 100% occupancy. Stores are more crowded. And if you go to the grocery store and just walk around, I'm seeing, just by estimates, by crude estimates, about half the people wearing masks, whereas back in April and in May, I would say that 90% of people were wearing masks. So it's the fact that we have what I'll just refer to as COVID virus fatigue with regard to our social interactions, that we've let our guard down. And the way we can fight back, the way we can get back on this horse, is to use masks and to return to what thwarted the virus in the first place. And I hope everybody who can hear this will do that.
Well, but even more beyond what you're talking about, it's the hospitalization rates that also are causing some concern, correct?
It is true. The whole problem in Seattle when it first hit this country back in the spring, and in New York City most recently, which is vividly etched in everybody's mind, is the fact that the medical care system can be overwhelmed if the number of people who come to attention in a hospital need specialized care. What that means is the number of available ICU beds, the available experts to treat the patients, the number of respirators that may be needed, all can confound our ability to take care of the population. So the whole idea is to not reach that threshold. So there's plenty of latitude in the system, some flexibility, so we can take care of other patients. One thing to remember about this whole episode is that heart disease, diabetes, cancer, strokes, dementia, all the diseases that we usually are focused on are still there. And so we want to leave plenty of room to take care of those individuals and not have to squeeze the system with all of these infected COVID-19 patients.
You talk about how there is that fatigue out there, and I certainly see that when I'm out and about. People are a lot more complacent than they were several weeks ago, and how this is really not a natural way for us to live. It's not natural to have your face covered all the time. Coming back from maternity leave, I wanted to hug a lot of people around the office, and you have to restrain yourself. But you're talking about the rededication to all of those things is critically important, and because it has worked. So explain what we need to rededicate ourselves to as we're seeing this surge.
Well, first of all, I share the frustration that you're experiencing as a grandfather. Not being able to see my grandchildren is an oft-repeated tale in this time. We just had Memorial Day. In just a couple of weeks, we'll have the 4th of July, and then we have Labor Day. And if this model is correct, it predicts that somewhere in August, we'll see a new peak. And to thwart that peak, to blunt that curve, we need to do 3 basic things. First of all, we need to reposition ourselves with regard to mask usage. Everybody should be using a mask. They're very effective. Even a surgical mask that's like this is very effective. Wear a bandana, put a handkerchief around your nose, do something that interrupts this process. They're very effective. Secondly, we should return to the meticulous way we wash our hands and how we touch surfaces, then touch our face and our eyes and our nose, and use hand washing and hand sanitizer. And third, and this is probably the hardest thing to do for many segments of our population, I believe we should avoid crowded indoor venues, especially things that are a party atmosphere. And the reason is that leads to incautious close contact. And what that means is you don't know whether the person you're talking to has inadvertently become infected and is a silent case and is shedding the virus. So you've got to be really careful now. I know that fatigue has set in. I know how tiresome it is. But this is our defense. The good news about it is it works. The bad news is it's terribly fatiguing and can get your spirits.
We've seen it work. We blunted, the April and May numbers. We blunted those numbers. But you've been at UT Health San Antonio since 2009. Have you ever issued an urgent call like you're doing today?
No, I can't remember anything along these lines. We've had crises before. We've had major healthcare challenges before. But to me, I'll say I'm older than both of you, and I can certainly say in my lifetime, I have never seen anything that challenges us in this way on so many levels. The healthcare system, yes, but it challenges our very social nature. It challenges the way we live in a fundamental way. And so it's going to be something we won't forget. It'll be something that we look back on and say, that was rough. But it is what it is, and we have to respond to it with these measures that we know will be successful. Your point's right. If we follow these measures, we'll lower the curve, we'll keep the healthcare system intact, we'll be able to take very good care of the people who get sick and save lives. And if we don't, then we'll be in a place where we'll have more collateral effects from the disease, and heaven forbid we'll lose more people. And that's something we just can't afford to do.
Doctor, should we be expecting a third wave of COVID-19 cases?
Right now, without a vaccine and without an antiviral, the prediction is we'll see another spike, hopefully one we can mute in the fall. I listen to the same experts you do, the same experts who are tracking the hundreds of projects, the thousands of projects which are dedicated to either an antiviral that will cure the disease or a vaccine which will prevent it. And if you're on the optimistic side of those reports, the best prognosis for us is somewhere around the turn of the calendar year, we'll have in our hands a vaccine that can be mass produced and that will be effective. And hopefully before then, we'll have an antiviral which will save lives and prevent the serious illness, the pneumonia, which has killed people. So that's the time frame. But right now, until we have proof of those two things coming to light, what we have to do is do what we can do to protect each other. Using this mask is a sign of respect and caring for everybody whom you meet. And everybody, in my view, wants to make sure they don't have any people get sick from inadvertent spread. So use the mask and pay attention to what you can do.
Absolutely. We can do this together. We're all in this together. So wear those masks, social distance, hygiene. So important. Dr. William Henrich, UT Health San Antonio, appreciate your time.
Thank you. Thank you.